definitely. I'll direct my next question to Shamiso. So according to UNAIDS data, 1.4 million people are living with HIV in Zimbabwe, 12.8% ranging between the ages of 15 to 49, 40,000 new infections recorded, 20,000 AIDS-related deaths, as well as 86 and 71% in adults and children, respectively, on antiretroviral treatment. How is the Zimbabwe Association of Church-Related Hospitals playing a role? How is it playing a role in this initiative, and are there specific support structures that you have set up?
Okay, so first things first, ZACH is a faith-based organization which has an inclination with church-related hospitals, and we cover 70% of the country in terms of health delivery. So we have played a very pivotal role in contributing towards the 95-95-95. And as for the support structures that we have put in place, we have faith-based organizations that we work with, because we know most people go to church and they follow different faiths. So we have partnered with faith-based organizations to reach out to the people so that they access HIV services. We also work with young people through a partnership with AFRICAID, trying to reach out to young people, because as you understand, most of the adolescents and teenagers are now indulging, and so we're trying to get to them so that they protect themselves from contracting HIV. We also work with different partners who are already in the HIV programs.
Okay. Mm-hmm. This most certainly sounds as if your program and initiatives are far-reaching to communities and through your churches. Mm-hmm. But now let's make it a bit more contemporary. Zimbabwe has been under the COVID-19 lockdown restrictions since March. Mm-hmm. How has this hindered accessibility of your services? How did you cope? If you could probably just touch on that, and Sarah, you can also give that as well.
Okay. Yes, COVID has affected everyone, and us included. So what we have tried to do with the help from the Ministry of Health, for people living with HIV who are already on ART, we advise people living with HIV to take their meds in advance, like 3 months in advance, 6 months in advance, so that they minimize their exposure to COVID. And we also have outreach posts where they can access services in their communities. For example, we have set up community posts, what we call community posts in Bare. We have 2 posts there, that even people they're working, they can access HIV services in their workplaces.
I'll just intersect you there. You've mentioned that you'd advise people to collect their medication 3 months in advance. Mm-hmm. Have you had any challenges in terms of availability of the medicine, considering it would be 3 months in advance?
Not recently.
Not recently.
Yeah, we thank our partners for availing the medicines. Mm-hmm. Yes, no, we didn't have any stockouts. What could have happened at some facilities is that they wouldn't have ordered the medication in advance. That will lead to a temporary stockout, not meaning that NatFarm is run out of meds. No.
Oh, okay, that's good.